Welcome to Healthcare Shapers Perspectives, where we bring you the insights from the experts shaping healthcare today. Hosted by Diane Bryson of Inspired Health Strategies.
Hi, welcome to another podcast in the series sponsored by Healthcare Shapers. And this one is and I'm Diane Bryson, your host. I shouldn't forget that. But I'm talking, probably more importantly, I'm speaking today with Joe McMenamin, who has some interesting things to talk to us about the use of AI in healthcare. Joe, I'm going to hand it over to you to introduce yourself.
Thank you, Diane, and my thanks to my colleagues in Healthcare Shapers for setting this up. As Diane said, I'm Joe McMenamin. I am a lawyer in private practice in Virginia, and I focus on the law of digital health and of the use of artificial intelligence in healthcare.
And that's an interesting topic. It's edgy, and you're at the forefront of this. So we're interested in hearing your thoughts on the use of AI, since it's so early. I guess, healthcare takes so much for us to change and adapt to anything. So it's really going to be interesting to hear what you have to say about AI. So why don't you tell us first how you think AI can be used in healthcare?
Well, there are a lot of possible uses, Diane, and I can't begin to do justice to the whole list. But an area that AI has found a lot of use in is in drug discovery, taking a large number of compounds and sorting out which ones are likely to have therapeutic value for patients and which ones are not. AI is also being used in clinical decision software. Guides to doctors and others as they write orders in hospital charts, for example. If I'm writing an order for penicillin and I've forgotten the patient is allergic to it, the AI may pop up a little message to me saying, don't forget that Mr. Jones is allergic, and then I can correct what I've written. They're useful for diagnosis, for example, the interpretation of diagnostic images such as pathology slides and x-rays and so forth. AI is being used to guide therapy, radiation therapy in cancer. It's being used in the management of various psychiatric diagnoses and in making prognoses, predictions about how a given patient will do or not do. And that's just a flavoring. The imagination of the people behind this is not to be belittled, and they've got a lot of ideas. And I think the future for this is potentially very bright.
So I'm going to go back to your point around drug discovery. What is the distinction? And I really have no idea about this, so I know that our audience is just as curious as I. What's the distinction between explainable AI and unexplainable AI?
Well, at a superficial level, at least, that's relatively easy to understand in this sense. Explainable AI, just as the name suggests, is artificial intelligence that arrives at the answer to a question in a fashion that we humans can follow and understand. The AI that is explainable is designed to explain the intent of the program, the algorithm, the reasoning process, the decision-making process, and it permits humans to follow what's going on. With unexplainable artificial intelligence, in contrast, we humans can see the inputs, we can see the outputs, but we're not able to understand or even see the inner workings of the system. In effect, unexplainable AI generates its own algorithms based on examples and on the desired output of the system, and we're not able to understand it, and even the people who designed the system in the first place are unable to understand it because the system changes with time, with use, and with experience. That, in my field and the law, that has very interesting implications with respect to such matters as regulation and liability, for example. So AI can be explainable in some cases, in many cases it cannot. Some of the more interesting and sophisticated uses are indeed unexplainable, but also, as at least from my standpoint, also a little bit worrisome since we really don't know what the black box is doing.
So let me make sure I have this right. So the unexplainable AI is simply the machine learning, and it's learning, and it's redoing things because it's learning. Is that right?
Yes, ma'am. And an example is a system called Deep Patient, which came from UCLA. By some mechanism known only to itself, the AI system became able to discover patterns in the hospital's data that enabled the system to diagnose or to predict risk of liver cancer. Now, that's very useful and very helpful, but even the smart folks who put this thing together can't explain to you how it did what it did.
Well, then how can they verify that what the AI did was right?
That's an excellent question and a source of a lot of debate. And unfortunately, in some cases, the answer is we haven't done that. And there have been some significant errors because validation has not been pursued with the kind of vigor that it should be. But generally, what is done is that we train AI systems on enormous volumes of data. And we teach it, so to speak, to distinguish between category A and category B of a particular problem. And over time, it begins to develop an ability to do that. If it's done carefully and properly, then after the fact, after the machine makes whatever decisions it makes, humans go back and check for accuracy. And when they find errors, then they tinker with it further until the system improves. Unfortunately, in some instances, that has not occurred. But generally, I think validation is a process that, among other things, involves seeing whether the predictions or the categorization that the AI arrived at bear some connection to reality or not, and if not, then to keep at it until you've got something that actually works.
So this is really complex. All right. So, and we're all throwing around this term AI, and at least I know I didn't realize just how much more complex this is. How about with the? Oh, go ahead, please.
Well, I was going to make just this point that some folks, the American Medical Association is a good example, prefer to refer to it as augmented intelligence, in that this is a set of machinery, a mechanism to enable humans with the knowledge, experience, training, and empathy, of course, that humans have and machines don't, use all those skills and all that knowledge more effectively, more intelligently than they could without the boost that AI gives them. But complex, yes, there's no question. It really is. And the future seems to suggest it's going to get more so, not less.
Mm-hmm. And that's where you come in.
Well, I hope I can be of some use to people that are interested in the field. It's young enough that the law in this area is not as well developed as presumably it will be in 5, 10, 20 years. There are lots of unknowns for which we don't have good answers. But part of the reason this is an appealing topic to somebody in my shoes is precisely that it's fun to wrestle with these problems, is to try to come up with reasonable and intelligent solutions when the law is a little bit less clear than we would ideally hope for.
So you're helping to really chart the space.
Well, I'm not sure I would go quite that far. I will say that some of my clients are.
Okay. And so
I got into this originally when a client of mine came up with an AI tool designed to help guide the care of sickly elderly folks, people who are eligible for hospice, so that as they come closer to the end of life, their care can be more humane, more effective, and more in keeping with the values and goals of the patients themselves, as distinct from trying to necessarily eke out another 3 weeks of existence if the price of that is high for the human being that we're talking about.
And the family. Yeah. So that hit home for me because I've gone through that process and have had to make those decisions myself and would have loved some help. I'm going to go back to another area you talked about, and that was clinical decision support software. How has AI played a role there?
Well, the AI system will, if you will, look over the shoulder of the doctor or whoever is writing a chart. And because it has already mastered the entire history of the patient, including a drug history, including possibly the genome, the AI knows, in quotes, a lot about the patient that we're trying to care for. And while the AI itself, in my view at least, ought not be in charge of clinical decision making, it can provide reminders, it can provide guidance that humans, with all of our remarkable capabilities, might in the moment forget or might overlook. And so AI has the whole system started with prefab, if you will, instructions to chart writers to try to avoid mistakes. Over time, as the system got more sophisticated and from experience began to learn more itself, the AI sort of taught itself things to look for. And in some instances, it's been able to identify patterns within a hospital, suggesting that for whatever reason, in this particular hospital, maybe a patient with, I don't know, congestive heart failure might do better on the D wing of the 6th floor as opposed to the E wing of the 5th floor.
Wow.
And the like. And so it has partnered with the care providers in trying to provide the best care we can. It's still in its infancy. There's a lot that we have to learn, but initial signs are encouraging. At the same time, we have to recognize these things make mistakes. A very good example, in my view, rose in Mount Sinai in New York. The folks there were trying to figure out which patients were at highest risk for developing pneumonia, which is a very common infection among hospitalized patients for a variety of reasons. And they developed this AI system that did a great job, not immediately, but over time it got to be really good at predicting which patients were likely to get sick with pneumonia and which ones were likely to be better off. Except when they tried to apply this same system in another hospital, it didn't work at all. It fell flat on its face. So they scratched their heads. Eventually they figured out that what the AI system at Sinai had managed to do was to teach itself to distinguish between those patients who had had portable chest x-rays at the bedside and those who instead had been sent down to the radiology department for a more formal study. And of course, the reason that matters is that those patients who are sickest tend to get the portable chest x-rays because the doctors and nurses don't want to take the risk of letting the patient out of their sight for too long, as would happen if they were sent down to radiology, whereas those patients who were in a little bit better shape could manage to take that journey safely and without undue risk. So when they try to apply it outside the walls of this one hospital, it no longer worked. An example of the kinds of mistakes that we have to be on the lookout for.
But couldn't they then just go back and reprogram the AI to incorporate
Yes,
information?
the question is, will we recognize these problems before somebody is hurt or not? And if we're on the ball enough to figure out that, hey, this is not really solving the problem we wanted it to solve before we, in reliance upon faulty information, make a decision that turns out to be incorrect, or are we instead going to be able to prevent that? And I don't think, I think the jury's out on that, and I imagine it's going to vary from case to case. I don't wish to rain on the parade. I wouldn't pursue this topic if I didn't think it had promise to really improve the quality of care for a lot of people. But we do need to be aware that that nothing is perfect, including artificial intelligence.
And you're touching on an area that inadvertently, I bet, that make people fear AI, that this is going to replace humans altogether. But what you're saying is that there has to be a human touch in there somewhere. Is that right?
Certainly, I would say that's true in 2021.
Okay.
There are real gung-ho people who are pushing this agenda who say the day will come when machines can handle everything. I'm a skeptic on that score, if only because I don't think that the most sophisticated AI system in the world will ever be able to replace a doctor with a good bedside manner, a nurse with genuine compassion, empathy, and understanding of her fellow human beings. I believe, and I'm no mystic, I was trained in scientific medicine. I consider myself a student of the subject. But I am a believer that there is such a thing as the therapeutic relationship, the therapeutic alliance between provider and patient. And it's not just a matter of brains, and it's not just a matter of intelligence, knowledge, skill, experience, training. All those things are important. I'm not belittling them in the least, but the human touch is something that no machine is able to emulate, and I doubt ever will be. So there is concern. There's concern about professional unemployment, for example. That some physicians think that radiologists will someday not be necessary. There's even an idea that we should develop a whole new specialty, information specialists, who are trained in dermatology, radiology, pathology, other visual specialties, but whose main claim to fame is a mastery of artificial intelligence so that they can use the technology in the best possible way. that strikes me as a possibility for the future. I certainly think there will be a need for physicians and others in healthcare to adjust to this brave new world that we're entering. But I do not believe that mass unemployment is going to happen. Instead, I think that the job description of the doctor, of the nurse, of the psychologist will change over time. But we're still going to need these folks just as we always have.
So AI is an instrument.
I think so. Now, there again, there are people who claim that AI is more or less human or close to it, so much so that they're arguing, for example, that it ought to be possible to find an artificial intelligence system liable, just as a doctor or a nurse or a hospital could be liable for bad care. Now, there's a fair amount to debate about that subject. But there is serious scholarship out there arguing for it, and there's at least one country, Saudi Arabia, I believe, that has actually awarded a patent to an AI system, even though it is not human. So there are some astonishing things going on out there.
No kidding. You know, I know very little about the health system in Saudi Arabia, but I do know that they have been on the edge in a lot of areas. So I guess this is one.
So it seems.
So what you've talked a bit about the ups and the good and the bad of AI, and talked about the human factor and how important that still plays a role. Are there risks that we should consider with AI?
Oh, absolutely.
Like algorithm failure. I've learned about that through you. Can you talk a bit about that?
Algorithm failure is just a term that, well, means what it says. An algorithm is a decision tree, and in theory, it should lead to the right answer if you've carefully asked the right questions, and if yes leads you in one direction, no leads you in another, the next question does the same thing. Theoretically, it should work just fine. But we humans are still relatively new at designing AI, and it's going to get better over time. A good example of an algorithm failure was an effort in Canada to try to identify those folks who are at highest risk for Alzheimer's disease. So the system involved, among other things, a whole bunch of questions that the patient was supposed to answer. And what the AI system was trained to do was to recognize speech patterns on the belief that people who were either in early Alzheimer's themselves or were headed in that direction might not be quite as articulate as the rest of us, might have a little more trouble forming sentences, might have a little more trouble with their words, et cetera, et cetera. Well, what happened was the AI system determined that certain people did seem to be at higher risk of Alzheimer's, but on following them over years, they didn't seem to be, in reality, in real clinical fact-finding, any more at risk than anybody else. And why was that? It turned out that this system, which was based on use of the English language, was being used to test Francophone Canadians. Historically, we have the French speakers and we have the English speakers. Well, I guarantee, I took high school French, and I stink. It's just that simple. And if you ask me questions in French, even assuming I could understand the question, and even assuming I know the answer, my ability to articulate a clear, nicely spoken, articulate answer, pretty pathetic, frankly. So does that mean I'm at higher risk at Alzheimer's? Well, I hope not. I hope it just means that I'm lousy at French. This is an example of where the algorithm failed. No one thought of that ahead of time. Now, in retrospect, it seems fairly obvious. You've got a country that historically has lots of French speakers and lots of English speakers. Why wouldn't you think of that? Well, that's easy for us to say. We have the benefit of 20/20 hindsight, and now they understand this problem. It probably won't happen again, but it's a good example of what can go wrong.
Yeah, it sounded. I had a similar example tossed at me today, looking at planning meals around drug taking, and if you're in a religion that fasts all day, how do you handle that? We didn't think about that. So those situations do come up when something's actually, and that's the benefit then, it sounds like, of having something really out there in the field that you can get to learn.
Absolutely, yeah. I think if I would offer a suggestion or maybe even a criticism of the field in general, is to do more validation than we've been doing, and just make sure this stuff really does what it's intended to do. It has, in some cases, been absolutely marvelous what it's been able to accomplish. It has achieved some great results, and I don't want to lose sight of that, not for a minute. But at the same time, just recognize that We are, frankly, we're sort of rookies. We humans are sort of rookies in this field, and rookies make mistakes, as do the machines that they create.
Well, that sounds like actually a really good note on which to end. That's some really good advice. I have really enjoyed talking with you. I've learned so much. Every time we've talked, I've learned something else. So is there anything else that you would like to add before we close?
Well, my thanks for your kind words. I appreciate it. And I assure you it's a two-way street. I learn from wherever I can learn, and you're certainly on my list of teachers. But I would say that just in general, be open-minded to this. Don't rule it out because it's going to wipe out humans. I don't think that's going to happen. On the other hand, don't get so enthusiastic about this that you lose sight of the fact that it has risks, just like everything else in healthcare. And if my doctor recommends I take aspirin, which has been around since the 1850s, 1840s, extremely well-known drug, generally very safe, that doesn't mean it's free of risk. And people die from taking aspirin. Not very often, but they do. So that doesn't mean we don't use aspirin. It means we use it carefully. We use it with knowledge that there are risks as well as benefits. I think the same is true here.
That sounds like great advice, Joe. Thanks so much for spending time with me and doing this podcast. And to the audience out there, hope you learned like I did from Joe. Take care. Thank you.
Thank you for watching Healthcare Shapers Perspectives, where we bring you the insights from the experts shaping healthcare today. For more episodes, visit healthcareshapers.com/perspectives.